I'm Dee Dawson, I'm 63 years old, and for the last 4 or 5 years I've really noticed that my lips are getting a lot thinner than they used to be. I've tried having them tattooed a little bit over the line, but it doesn't have a wonderful effect. So I'm here today to see Dr. Rakus to see if she can suggest anything that will improve them for me. I'm really excited to see what she has to offer and if it's going to make me look younger. I really hope this is going to transform me.
Good. And lips will start to feel very shortly. Okay, and we'll reapply it generously. Good.
Hello, I'm Dr. Rita Rakus, a cosmetic physician in Knightsbridge. Today we're going to work on Dee's lips and rejuvenate her perioral commissures and give her a tiny bit of volume in the lips. Alright Dee, so if you'd like to bring the mirror up, we'll just have a little look at your lips here. So what I propose, with your consent today, is just to lift your corners here a little bit. Pop a bit of fill around here, maybe lift your lip up a little bit here. How does that look to you?
That would be good.
Excellent, alright. So just come forward for me, that's it, wonderful. And the main thing is just to keep nice and still. So just little injections here. Shouldn't be too painful. You've had your anaesthetic cream on for a while. Just lifting your corners of your mouth here nicely, wonderful.
What are you using, Rita?
We're using a Juvederm Ultra, which is a hyaluronic gel, which is totally natural and fully biodegradable. Okay, so that's not too bad, is it? And we're going to go a little bit higher up in the corners of the mouth on the top. This is Juvederm Ultra 3. Coming up nicely. Alright, so we'll do a little bit more around here and then we'll do some in your lips. So it's nearly over, it's not bad, is it?
Not at all. Certainly tell you've done this before.
About 40,000 treatments. Alright, so don't smile for me, don't smile. Excellent. Alright, now just pout your top lip for me, like that. Okay, relax, stop pouting. Yeah. This is sort of what we call the perioral area that we're doing. Alright, now we'll give you a tiny break and put some ice on, and then we're actually going to do your lip, alright?
The needle's rather sharp. I wouldn't say it was painful, it's uncomfortable, but it's very quick. So by the time you think that's probably enough, it's finished and you're on to another bit. So it's bearable and it's all in a very good cause.
So now we're going to use some Juvederm Smile on you, Juvederm Ultra Smile, specifically designed for the lips. And you'll see, I showed you the Juvederm Smile brochure, didn't I, with the lips in it, that they're actually the lips I did for Juvederm in their brochure. So you can see it's nice and natural. All right, now if you come forward for me, I'm just going to pop a bit in your top lip. Just open up your mouth for me. That's it, wonderful. Nice and still. Excellent.
Rita, how is Juvederm Smile different to Juvederm Ultra 1, 2, 3 and 4?
It's specially designed for the lip, a little bit more softer, a bit flexible, more flexible. Okay, now just close your lip for me. That's it. So as you know, the lip, there's a lot more movement in the lip than it's a bit longer lasting.
How long does it last for?
About a year. Okay, just open up your mouth for me. Big smile for me. Okay.
And do you do top and bottom lips?
Just depends what size they are. Sometimes you only need the top, sometimes you need both, sometimes you need top and bottom. We're going to do a little bit of both here. Okay, coming along nicely. A little bit more here in the corners. Here's some arnica cream that we're just going to wipe down a bit just to tidy up a bit. How's that? Nice and soothing?
Fine, thank you.
Excellent. How's that looking for you? You happy with that?
Okay.
Obviously, you know, we can't lift all this up, but I think you've had a nice subtle treatment. It's quite good. What we would normally do is get you back in about 2 weeks, then have a little look. So we don't want anything too obvious. You get very few side effects, but with any lip injection you can always get a bruised or a little bit of swelling or redness, but I think we've done very well today. I don't think there's anything there. Now just sit up for me. That's it. But basically what we do, and you can move that ice for a second, a little bit of massage morning and night for about 30 seconds, and I'll show you how to do that. Avoid extremes of heat and cold in the next 24 hours. So no saunas or heli skiing or anything. Right, just open your mouth up for me, wide. And a tiny bit of massage, just for about 30 seconds morning and night for the next few days. You settle down quite quickly, it looks quite good. So obviously if you'd like more of a lift through here, you know, you need other treatments, but we've just tried to focus around your mouth and get that looking nice and fresh. Nothing too obvious though.
So I've just finished having my treatment. Actually it was much less painful than I imagined it would be to have injections into your lips. I thought it was going to be very painful, but actually it wasn't any worse than the injection into the skin around the mouth. As I said before, it wasn't pleasant, but it wasn't so bad that you couldn't bear it, and I'm pleased with the result, and I think over the next few days it will settle down a bit and look a bit more natural than it does now. Yes, I'd certainly do it again. It was a very worthwhile thing to do, I think.